This is Dr. Paul Firnhaber, and this is 10 Minutes of Truth. So, today I want to discuss an article that's right here, comes out of a journal called Cancer and Metastasis, May 2020 of this year. So, it's a very current article. And the name of the article is A Dual-Pronged Approach to Averting Cytokine Storms in COVID-19 Inflammation Resolution. And the gist of this article, which I think is a very important article, is about the importance of a chemical in our body called ecosinoids. Now, I first learned about ecosinoids back in the mid-90s, 1990s, when I read a book called The Zone by Barry Sears. And he was the first one that introduced me to the concept of ecosinoids and how important they are in the body. And ecosinoids are basically hormone-like substances which essentially run your body. So it'd be like, when you buy a brand new, like 2020 automobile, there's computers in that car that basically run everything. Well, ecosinoids are like that. And ecosinoids are, this article says ecosinoids are a gang of at least 100 powerful hormone-like substances that control virtually all physiological actions in your body. The most important thing about ecosinoids is to keep them in balance. And essentially, all inflammation in the body is controlled by ecosinoids. So you have ecosinoids that increase inflammation, you have ecosinoids that decrease inflammation. And the inflammatory response in the body is actually a very important response, and we need the inflammatory response. It's a healing response. The problem is that when these ecosinoids are out of balance, inflammation is out of control. Now, the problem with the COVID-19 and the problem with a lot of people that die and even a lot of people that survive COVID-19 is they have organ damage. In other words, it tends to damage organs, especially the lungs. And so ecosinoids, your balance of ecosinoids determines, first of all, how much inflammation you have in your body. But if you get something like COVID-19 or you contract it, how much damage it's going to do to your body and how fast you get over it. So what are ecosinoids made out of? Well, this is the important thing. Ecosinoids are primarily made out of fat. And so they're made out of omega-3 and omega-6 fats. Both are essential fatty acids in the body. And so you need a balance of this omega-3 and omega-6 fats in your body. Now, the problem is in American culture, Americans eat way, way more omega-6 fats than they do omega-3 fats. So most people carry inflammation in their bodies. They carry a low-grade, destructive type inflammation. And the reason is because they're eating way too many fats derived from vegetables like corn oil, safflower oil, peanut oil, sunflower oil. Those are all omega-6 fats, and we need that, but we're eating too much of it. Another group of ecosinoids that's very damaging comes from your trans fats. For example, trans fatty acids, hydrogenated fat, which it constitutes a tremendous amount of the fats in processed foods and even in your fast foods. The ecosinoids, which are abnormal ecosinoids made from these fats, are highly, highly inflammatory. So anytime we have an imbalance in these fats, we can have problems when we get sick, or even if we're not like acutely ill, we can have this chronic low-grade inflammation that contributes substantially to aging and to chronic illness. Now, how do we, what do we have to do? Well, the major thing, and this article talks about that, is we can control these fats completely through our diet. And we can control it somewhat through taking the right fatty acid supplements. So, for example, if you take or eat cold water fish, flax, walnuts, um, foods that tend to be high in omega-3 fatty acids, and you tend to avoid foods that are high in the omega-6 fatty acids, you're going to tend to have balanced ecosinoids. And really, we should have about a 2-to-1, ideally, a 2-to-1 balance of omega-6 to omega-3. The problem is, in this country, that imbalance is quite a bit worse than that. You see 20-to-1 is pretty regular. I've seen as much as 160-to-1. We know that when you have a very significant imbalance above 60-to-1, like 70-to-1, that actually changes, can create things like depression, anxiety, suicidal thoughts. It changes the way the brain functions, since the brain is primarily made of fat, and there's a lot of omega-3 fat in the brain. Well, getting back to COVID-19 is that the resolution of inflammation in COVID-19 is an active biochemical process, and hyperinflammation may result from a deficit in the active anti-inflammatory biochemical process. Well, the deficit comes from what we are not getting in our diet. And so basically, essentially, what this article is saying is that people who get heavily damaged or who die because of the COVID-19 have significant imbalances in the ecosinoid chemical structure in their body. And so my advice to you, and the purpose of this video, is to really be careful about what kind of fat you eat. Okay, so we want to eat, let me just read you something from the article. It says, thus activating endogenous, or coming from the inside, resolution pathways with omega-3 fatty acids may be a novel therapeutic approach to limit severe organ damage and improve outcomes in COVID-19 patients. In other words, somebody who gets COVID, they need to give them lots and lots of omega-3 fatty acids so they can make the ecosinoids they need in order to avoid the enormous amount of inflammatory damage that this virus produces. So my advice to you is, number one, eat lots of cold water fish. It's like wild-caught salmon, not farm raised. Farm raised is full of chemicals, and it's not a good product. Take omega-3 fatty acid, a good quality supplement, and you want to really cut down and avoid eating too many foods that are full of omega-6 fats, and you want to avoid trans fats altogether. Just completely avoid trans fats. Now, there's some evidence in kids that get this, it's called a multiple inflammatory syndrome in kids. And some of these kids just get hugely inflamed when they get COVID. Well, again, if you go back to the diet that they're eating, that's probably the cause. So feed your kids well. Feed them foods high in omega-3 fatty acids. Give them omega-3 fatty acid supplements. Really restrict the amount of omega-6 fats, the amount of processed food and fast food they're getting. And you do that yourself, and you'll have a less of a chance even catching COVID-19. But if you do get it, you'll get over it faster and can avoid all the damage, the organ damage that comes with it. Well, that's our talk for today. Hope you enjoyed it, and I will be with you soon for another 10 Minutes of Truth. This is Dr. Paul Firnhaber, and I'll see you again soon. God bless you.